Welcome to the February 17, 2026 edition of PAR Tuesday News Review. PAR TNR is your news about issues that are important to IDA providers in our community. Thanks for tuning in. PAR continues to work on the state fiscal year 2027 state budget ask. PAR is collecting stories from individuals and their families about the services they receive for submission to the PA General Assembly for PAR's advocacy purposes. The governor announced his budget proposal this week with no wage increase for direct support professionals. Congress ended a widespread federal government shutdown last week, including passing the Health and Human Services budget through September 30th. Please follow PAR and Anchor for further updates and resources on the federal budget. On February 3rd, 2026, Congress passed the Consolidated Appropriations Act of 2026 that included the extension of Medicaid buy-in program to people over the age of 64. Now workers over 64 who earn slightly too much to qualify for Medicaid will be able to continue to buy into the Medicaid program to keep the home and community-based services and supports that are not covered by Medicare. This victory for workers with disabilities has been a long time in the making. Due to the tireless advocacy of Ohioan Christy Brown, PAR, and many other disability advocates, disabled workers who turn 65 will not have to choose between their job and their Medicaid-funded home and community-based services. Workers with disabilities and the Medicaid providers that support them welcome the elimination of this unnecessary age limit. Also on February 3rd, the U.S. House Committee on Energy and Commerce Subcommittee on Oversight and Investigations held a hearing on waste, fraud, and abuse in Medicare and Medicaid. Expert testifiers described the estimated scope and range of fraudulent activity in Medicare and Medicaid. They mentioned durable medical equipment, prescription drugs, hospice care, genetic and clinical laboratory testing, wound care or skin substitutes, and treatment for substance abuse disorders as areas that they considered high risk for fraud. They cited the 2025 issue of Health and Human Services Office of Inspector General top management and performance challenges facing HHS, with two of the three challenges identified for Medicare and Medicaid being combating fraud, waste, and abuse, and ensuring the effectiveness and efficiency of the Medicaid program. To help address the perception of the damaging effects of fraud, the Trump administration is taking on new efforts to address Medicare and Medicaid fraud, including CMS crackdown on fraud and DOJ dedicating more resources to investigate and prosecute ongoing fraud schemes. CMS recently launched an audit of the Minnesota Medicaid program, freezing provider enrollment and deferring payment on 14 programs they deemed high-risk programs, including adult companion, autism behavioral therapy, rehabilitative mental health services, individualized home supports, and residential treatment services. PAR remains committed to working in partnership with our government partners to help our system be more efficient, effective, and sustainable. PAR will continue to monitor government strategies to address a perception of waste, fraud, and abuse in our system. ODP recently announced that the performance-based contracting residential submission portal will officially be opened February 16th to March 16th. Looking to strengthen your efforts and reach more diverse talent? Join PARedu this Thursday from 10 o'clock to 1 o'clock for Implementing Recruitment Strategies to Engage Diverse Audiences, a training focused on creative outreach, data-driven recruitment, and meaningful community partnerships. It's a must-attend for anyone involved in hiring, leadership, or organizational growth. Register by going to the PARedu tab at par.net. Thanks for watching PAR TNR, everyone. Stay safe, and we'll see you next week.